Hey guys, how's it going? Dr. Liz checking in, doctor of acupuncture and oriental medicine, where life becomes better living. Please feel free to like our channel and to subscribe to our channel so we can keep these wellness tips coming your way. We welcome your comments as well. Today's topic, heart health. So tell us about our heart, Liz. So as you know, our heart is a very important component of the human body. And the heart health can refer to any kind of cardiovascular disease, not only the heart organ itself. In fact, cardiovascular disease is the #1 killer in America, and it doesn't have to be. I will give you some tips today on how not to die from cardiovascular disease. So in Oriental medicine, or traditional Chinese medicine, or the world of acupuncture and herbal medicine, the heart is known as the emperor. So, and it is considered to be the most important visceral organ. It is important more than the brain because it houses the mind, it houses the brain. And the heart is in charge of the vessels. So we want not only to make our heart strong and make our heart healthy, but we want our vessels to be strong and healthy too. So our vessels would be our arteries, our veins, and our capillaries. So yes, I know they call me Doogie Howser of Martin County, but anyway, that's what we're talking about when we're talking heart health. So not only the visceral organ, but the veins, capillaries, and arteries. So how does it work, Dr. Liz? So all of our organs, veins, arteries, and capillaries are lined with what is called the endothelium. And so if the endothelium is clogged with plaque, then, our arteries, veins, and capillaries can also get clogged up with plaque or phlegm. So the pathways where blood and oxygen is carried, if it can't get through and transported through our bodies, then there's blood and oxygen can't get through to nourish our body, and ischemic attacks can occur, or strokes, heart attack, so forth, can happen if there's too much clogging in any of those pathways. So this builds plaque in our endothelium, is also known as atherosclerosis. Sadly, most Americans raised on a conventional diet have significant phlegm or plaque accumulation in the coronary arteries and accumulation inside. This is why heart disease is our #1 killer. So you ask, what is plaque or phlegm made up of? Well, good question. So plaque is made up of fat, calcium, and other substances found in the blood. And over time, it can create a hardness inside of the arteries and narrows, your coronary arteries. And this limits the oxygen and the rich blood cells, the red blood cells and hemoglobin, to get to the heart and the plasma. So, interesting, Dr. Liz, they say to me. What is the endothelium? And basically, endothelium is actually skin that lines all of our organs. So even though we have skin on the outside of our body, we also have skin that lines all of our organs and vessels, including all our arteries, capillaries, and veins. So we not only have the skin, like I said, on the outside of our body, but we have it on the inside of our bodies too. So my clients ask, is that what happens when someone gets a heart attack or a stroke? And most commonly, yes. Dr. Liz with the Liz. What is the best thing to do to reduce risk of cardiovascular disease? So, number one, stop smoking. Number 2, get regular exercise. And number 3, change your diet. Makes sense. So, according to the meta-analyses, a gram of fiber a day from whole grains is associated with a lower chance of dying from heart attack and reduces risk of cancer. So it also helps reduce the risks of respiratory diseases and helps lower the risk of infection, and even helps to regulate our blood sugar, diabetes type problems, mellitus, diabetes type 2, diabetes mellitus. So it's best to consume healthy fruits and vegetables. So what does a Mediterranean diet consume of? Well, grains, fruits, lentils, beans, nuts, seeds, vegetables. Delicious. Love that. So people say, sounds tasty. What if someone wants to take care of their heart health but is gluten intolerant? So what types of whole grains should they eat? Well, great question. So, sure. So whole grains that are gluten-free and help protect your heart include quinoa, teff, which is a staple grain of Ethiopia, and one of the smallest grains in the world. Teff. Okay. So it's a good source also of iron, calcium, protein, fiber, and B vitamins. So, sorghum is another one that a lot of people like to eat. Highly nutritious, cost-effective, and a gluten-free grain. Also high in the vitamin Bs, as well as iron, copper, potassium, and protein. Sorghum. Buckwheat, despite of its name, is also not a form of wheat. It lowers cholesterol and blood pressure. It's high in antioxidants, so anti-aging, and can help prevent, regulate blood sugar and potentially help prevent diabetes type 2 or diabetes mellitus, the onset of such. And it has a lot of good vitamins and minerals in that. Buckwheat. So you can also incorporate a variety of different rices. So what if someone is a vegan or a vegetarian? Can their diet protect heart health? So a vegetarian or a vegan may also work too, of course, but it usually should be accompanied by some type of a vitamin B complex or B12, or what we just referenced as far as some of these grains, such as buckwheat. How many people die each year of heart disease? Well, gosh, this information might be slightly outdated, but like over 600,000 people die every year of heart disease in the United States alone. And that's like 1 in 4 deaths. So stroke kills about 5 million people each year, probably now more, and that's worldwide, and is the top neurological disorder that debilitates people. So, if we can dodge the possibility of stroke and heart attack and cloggy veins, arteries, and capillaries, let's do it, right? Let's work together to do that. So, where do we go from here? Well, we should, people ask, should I take an aspirin to prevent heart disease? And that's a good question. So the benefits of taking a daily aspirin must be weighed against the risk of internal bleeding. So is there a natural form of aspirin? There is. Salicylic acid, and the active ingredient in aspirin has been used for thousands of years as an anti-inflammatory and painkiller in the form of willow tree bark extract. So, Hippocrates originally used this to treat fever and alleviate pain during childbirth. So it also acts, as a blood thinner, as we know. And for those who have already had a heart attack, the benefits are clear that taking a low dosage of aspirin daily is, it's probably a smart thing to do. However, for those who've not had a previous issue, studies do show not the same. So the scientific methods to elongate life through cardiovascular practice is, we want to look at how many heartbeats you have in your lifetime. So the number of heartbeats per lifetime is remarkably similar. So whether you are a hamster, a whale, or a human, if humans are predetermined to approximately 3 billion heart rates per lifetime, can slowing the cardiovascular system increase a lifespan? Well, how do we put our finger, on the pulse of longevity? To maximize lifespan, the target resting heart rate may be 1 beat per second or less. So, the question is, do people with slower hearts live longer? And the answer is yes, they do. So a fasting heart rate may lead to a higher death rate. A faster heart rate can lead to a higher death rate. And leading to heart disease or heart failure, this information is independent of the level of physical activity. So fast heart rate is not only a marker of risk, but a bona fide risk factor. So this information is now well recognized. Lowering a heart rate lowers our death rate. And this has been shown in at least 8 or 10 clinical trials. 1 beat per second is the optimal goal. Is there any secret in medicine? The best kept secret in medicine is under the right conditions, the body heals itself. Which is why I went into alternative medicine, because it just makes sense. Drugs and surgery are super helpful, but not always for chronic ailments. So, under the right conditions, again, the body can heal itself. Heart disease is reversible. Originally, researchers blamed the animal fat or animal protein, but attention has recently shifted to bacterial toxins known as endotoxins. Certain foods, such as meats, harbor bacteria that triggers inflammation, and there are studies to support that. With or without exercise, patients placed on plant-based diets. And if you want to know all about plant-based diets, I highly recommend you go to Dr. Greger, nutritionfacts.org, because he is by far the leader in the States, worldwide, and an expert on that. But he's full of all kinds of data analytics, which are so amazingly helpful. But I'm just trying to give you guys a high-level overview of heart health. So animal and saturated fat is not actually the real culprit, but it is the endotoxins that we find that is really bad and concerning for research scientists. So they cause the inflammation within an hour after eating, and it comes from the food itself. So an endotoxin basically is a form of a sugar, and it's associated with a gram-negative bacteria. So the impact of such includes diseases such as E. coli, Bordetella, things like that. Even you can talk about meningitis can come from a gram-negative infection caused from meat and the bacteria in the meat. So can we eat fish? Do they have endotoxins? And the answer is, interestingly, according to the National Institute of Health, compared to animals, mammals, fish are resistant to the endotoxic shock. So therefore, they're not typically found in seafood, although we can have other issues eating seafood that's not properly cooked. So anyway, let's talk about cholesterol. That's another part of heart health, right? Cholesterol. And the impact that it has on our heart. So the first thing to understand about cholesterol is that cholesterol is not a fat. You heard right. It's not a fat, it's a hormone, and it's a hormone we must have. So cholesterol is a much needed to make hormone. Vitamin D and the substances that help with digestion. People are way over medicated with cholesterol medications, and inappropriately so in many cases. It's the ratio that's more important than the actual total number when we look at the studies of vitality, wellness, and death rates. So please explain, you say. Okay. So the ratio, like I said, is what is the most important when it comes to heart health and cholesterol. To calculate your cholesterol ratio, divide your high density lipoprotein, HDL, or good cholesterol number into, oops, sorry guys, I'm in a car, into your total cholesterol number. An optimal ratio is 3.5 or less. So what is considered a desirable level of cholesterol? A desirable level of cholesterol or total cholesterol for adults without heart disease is less than 200 mgs over DLs. An HDL cholesterol level of 60 mgs over DLs and above is considered protective against heart disease. That's where we want to go, folks. While a level of less than 50 milligrams over DLs or 40 milligrams over DLs for men is considered a major risk factor for heart disease. A low LDL cholesterol is best to prevent heart attack or stroke. Lower than 100 milligrams over DLs is the ideal. So if your total cholesterol is 200 and your HDL is 60, your ratio is 3.33, which is good because it's less than 3.5. So on the other hand, if your total cholesterol is 300 and your HDL is 100, there is nothing wrong with that cholesterol and only a 40 HDL. So as you can see, the ratio is more important than the total cholesterol levels when it comes to heart health. So I think it's important to explain that. What about hypertension? Hypertension, okay. So hypertension is another name for high blood pressure. So it measures the force of the blood against your artery walls. So blood pressure is determined by both the amount of blood your heart pumps and the amount of resistance to the blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. So the top number is known as the systolic and the bottom is the diastolic. So can you have high blood pressure without knowing it? Oh yes, you surely can. So it's a good idea to monitor your blood pressure. So I have patients that come in, they're basically healthy, but they have borderline hypertension or high blood pressure. And they ask me, how do I lower my blood pressure? So obviously you could take a statin from your medical doctor. But in addition, or instead of, depending on what your doctor advises, you can eat a healthy diet that is full of fish, fruits, vegetables. I guess some would call it a Mediterranean diet. Limit the amount of sugar you intake, exercise regularly. It's important to move and lose weight. So when you lose extra pounds, your blood pressure will also drop. So that is all good stuff, folks. A little bit more here on heart health. So, what should our blood pressure be? So, a normal blood pressure, according to the American Heart Association, should be no more than like 120 over 80. So, like 110 over 70 would be like textbook perfect. No more over 120 over 80. So, the systolic should be 120 or less, and the diastolic, the bottom number, should be 80 or less. Or I guess they allow, so 80 or less. So pre-hypertension is 120 to 140, and the diastolic 80 to 90. And high blood pressure stage 1 is 140 to 160 and 90 to 100 on the diastolic. Stage 2 is 160 or higher, 100 or higher, and hypertensive crisis is 180 over 110 or higher. So we don't want to go there. So give us some tips, Dr. Liz. Okay, sure. So here are a few tips based to help you live longer and prevent or reverse heart disease. Eat fresh fruits and vegetables, preferably organic and cleaned, lowering inflammation. Brazil nuts help lower cholesterol, just a few of them a day. So eat, I think it's like just 3 or 4 of them a day. And those can contribute to lowering cholesterol. Use organic coconut oil. It lowers the LDL. Meditate. Try to have calmness in your life. Be mindful. Improves heart health by calming the mind. Meditation. Practice this each morning and then before you go to bed. Move, walk, do yoga, tai chi, qigong, bicycle, swim, helps restore the endothelium. Prepare your food so it's not cold, including your fruits and vegetables, which facilitates your digestion. Cold, raw foods can, over time, be harsh on your spleen and digestive. Incorporate these 5 spices into your diet. Garlic is like a natural antibiotic. Turmeric lessens inflammation. Cayenne pepper stimulates circulation. Eat onions, cleans the blood. And green tea lowers LDL and triglycerides. Harmonize your relationships, work environment, create it to be peacefully as best as you can, and your home. Make it harmonious, all improving heart health, lessening stress, and calming your spirit. If you want additional information, I highly recommend Michael Greger's book, How Not to Die. It's an excellent book. My book is just a tiny little piecemeal compared to his, but I'm part of it, part of the healthcare plan, and always happy to help. So again, it is Dr. Liz, Doctor of Acupuncture and Oriental Medicine, coming to you today to help folks where life becomes better living. And please leave your comments below and like our channel, and please go ahead and subscribe to our channel. Leave any comments that you'd like us to further develop for you guys, and we look forward to seeing you jusqu'à demain. Until tomorrow, Dr. Liz with her Louise. Make it a great day.